Tension headache associated with neck tension. This is how tension headaches are expressed by neck tension. In our sedentary society, which is often characterized by little movement, a high level of stress and frequent media consumption, headaches in connection with shoulder and/or neck pain have easy time. Because the one-sided posture, for example when using a mobile phone, can quickly lead to tension in the neck and shoulder area. And this in turn wanders towards the head, the pain is already there. Stress can also lead to poor posture, such as constantly hunched shoulders, and thus to painful tension and headaches. In fact, this type of headache is even listed as a separate form of pain in the current diagnostic guidelines for headaches, ICHD-3 diagnostic guideline. Tension gone, headache still aching. The longer the tension headache caused by tension in the neck and shoulder area lasts, the more likely it is that a so-called pain memory will develop. This means that the nerve tracts still send signals to the brain even after the actual cause, the tension, has long been resolved. The tension headaches have then become chronic. Prevent and treat head, neck and shoulder pain. To prevent this, experts recommend exercising regularly. Do light endurance exercise for 45 minutes at least twice a week. Once the tension headache has arrived, it is important to remove it as quickly as possible, for example to solve with the help of heating or cooling applications. This succeeds for example by warming the neck with a hairdryer at a comfortable temperature for 15 minutes. This loosens the muscles and relieves tension headaches. Pain tablets also help relax the muscles, as they enable those affected to release their relieving posture. In the case of tension, those affected usually adopt a relieving posture, which, however, often represents a bad posture, which tends to promote muscle cramping. Another important point is to prevent or relieve muscle tension in the neck and shoulder area caused by psychological factors such as stress or even fear, for example, a cramped posture. In fact, the neck and shoulder area is a very stress-prone area of the body. Stress, for example at work, or psychological stress can typically also settle in these muscles. For tension headaches caused by neck and shoulder tension, targeted muscle relaxation exercises such as progressive muscle relaxation according to Jacobson, yoga or meditative running are helpful, both in the acute phase and for prophylaxis. Of course, an overall less stressful everyday life cannot be set up overnight. But if you know that your tension headaches are related to neck and shoulder pain, you can already help solve the problem. Slow down your life step by step. Consciously create islands of calm and gradually switch from stress to relaxation.